Let's discuss the foods for dry eyes. Now, the glands that produce tears and the little ducts that the tears drain through are controlled by vitamin A. So vitamin A has everything to do with controlling what those cells that line the inside of the gland and also the inside of the body, like the little ducts, and also other tissue that line the inside of your body. So if there's a vitamin A deficiency, the inner lining of the ducts as well as the gland can malform. It can get thicker, the tissue can get rougher, and the actual production of the tear or fluids diminish. So an average person who has dry eyes, not knowing this, will tend to get the drops in the eyes, and hopefully they won't go to the steroid drops because that creates all sorts of side effects. So the three top vitamin A symptoms would be, number one, dry eyes, night blindness. You can actually go blind. There's quite a high percentage of children in certain countries that are vitamin A deficient when they're very young and they go blind. So there's a huge connection between vitamin A and your vision. And then blurred vision. Now, vitamin A does a lot of other things too, related to your immune system, your mucous membranes. But for what we're talking about, dry eyes is definitely a vitamin A deficiency. Now, I don't recommend you go out and buy a vitamin A for this, simply because a lot of the vitamin A out there is synthetic, and that comes with a package. There's a lot of side effects. But here are the foods that are very high in vitamin A. The top one is cod liver oil. You can also get cod liver in a can. It's actually quite good. I put a link down below. Liver has a lot of vitamin A. Fatty fish has a good amount of vitamin A. Butter and ghee have vitamin A. Cheese has vitamin A, especially if it's fattier cheese. Egg yolks are loaded with vitamin A. And beef has vitamin A. Now, unfortunately, the actual definition of vitamin A also includes pre-vitamin A, beta-carotene, and some other carotenoids. This is not actually vitamin A, even though it's classified as vitamin A. It's because it has to be converted into the active form of vitamin A, which is retinol. So when you buy food and you look at the back of the label and it says has this much vitamin A, don't be deceived, because they could be talking about the precursor. Now, what is the significance of that? Well, the conversion to the active form of vitamin A is not that great. In other words, it takes 20 molecules of the precursor to convert into 1 molecule of the active form of vitamin A. Not only that, 50% of the population has a genetic variant, it's called a polymorphism, which prevents this conversion to a certain degree. So don't depend on your vitamin A for the precursors. Now, beta-carotene and other carotenoids, which are phytonutrients, have great benefits, other great benefits. They're antioxidants, they do a lot, but they're not the same as retinol. So if you're trying to fix your dry eyes and you're taking beta-carotene, it may not work. Retinol is only in animal products. So if you're a vegan and you have dry eyes, this could be the reason you're not converting to the active form of retinol. Now, there's other problems as well. Let's say you're consuming these foods right here and you still have dry eyes. Well, it could be you have inflammation in the gut because you had a history of antibiotics. It could be because you have some problem with your liver, fatty liver, or your gallbladder, or you had your gallbladder removed and you're deficient in bile. Or you have SIBO, small intestinal bacterial overgrowth, which robs certain nutrients. The way you would know that is every time you eat, you feel extremely bloated, especially with fiber and vegetables. And I already mentioned fatty liver, but it could also be an inflamed liver. So anything wrong with the liver can impair the ability to absorb vitamin A. And vitamin A is stored in the liver, but as it starts to fill up with fat, you lose the ability to store vitamin A and other fat-soluble vitamins. All right, I think I covered everything I wanted to cover. Thanks for watching. Before you go, if you have a question about a product, or you're new to keto and you want to know how to begin keto, or you're on keto and you need a debug because it's not going as smooth, I have a keto consultant standing by to help you. This is just for the people in the US. Hopefully in the future we'll be able to answer everyone's call, but I put the number down below. so you can call and get some help.